I'm Dr. Summer Gutschow. I'm a general dentist here in Omaha, Nebraska, and today I'm going to share with you some of my best practices on how to use ergo loupes. Today I'm going to be showing you how I would go through a procedure in the upper left quadrant. I think most right-handed dentists can agree that a crown on number 15 is maybe one of the most positionally challenging procedures to have to do. So I can understand how some concern transitioning from the traditional loop to the ergonomic loop is reasonable. I'm going to show you kind of a step-by-step from each of my previous positions to my new position with the ergonomic loop, how I would do a crown on number 15. The first thing I would do with a traditional loop is start using my indirect vision, something along the lines of this with a little bit of a lean. And I'm using my mirror here and kind of tipping to the side and angling my neck. I think you can also see how I posture my chin forward a little bit, and I have to lean my head forward to be able to see my mirror position. So if I'm going to do that same part of the procedure but using my ergonomic loop, the first thing I'm going to do is move the patient just a little bit. Working distance is a little bit further away using an ergonomic loop. So in some way you have to move the patient away from you. You're either going to move the patient or you're going to move your own chair. So for me, I like to tip the patient back, maybe about 10 degrees further, and then I like to have them tip their chin up just a little bit. Just that tiny little change in angle is enough for a really nice direct line of sight to my mirror. So here is my position. If I am doing that same initial step from the occlusal of number 15, and sometimes if my assistant retracts just a little bit more, I can even keep my mirror right outside of the patient's mouth and have a really nice, comfortable view of that tooth. Okay, I'm going to bring the patient right back up here. So now I am preparing the palatal side of number 15 for that crown, and I'm using my traditional loop in this example, and I'm going to look directly at that tooth. How I did it before, it was terrible posture, but I'd actually lean my elbow on my leg just like this and look directly at the tooth. Here I'm tipping my neck to the side, I'm pushing my chin forward, and that's how I can best see that tooth. Okay, so similarly to the adjustment I made before, if I'm doing that same area of the tooth, I tip her back just a little bit and I actually raise her up just a smidge. You'll play with this. You'll figure out what angle works best for you, and it's generally just a really small adjustment to look at that tooth differently. So if I want to use that direct vision again, I'm going to have Rebecca turn to the left just a smidge. Yep, just like that. And now I've got a perfect view of the palatal part of number 15. Now I've been using my ergo loupes for about 2 years, so I've actually changed how I do the palate, and I prefer to come from more of an 11:30 position here, and I use my indirect vision and go to the palate like this, and it's kind of an occlusal down view. It's more comfortable to my body, more comfortable to my neck, and I've gotten more comfortable using my indirect vision, which is really key to taking advantage of the ergo loop. Okay, the final part of preparing number 15 is looking at the buccal surface of the tooth. Now, if I were using my traditional loop, I would have Rebecca turn all the way to the right. I'm going to take my mirror and I'm going to pull that cheek way back. And I'm basically just laying on my patient to be able to see this. And this is one of the positions that makes number 15 a miserable tooth to work on as a right-handed dentist. Okay, so now I'm going to make an adjustment and show you how I do it with my ergo loop. I'm going to tip her back just a smidge. Allie's going to retract for me, and I'm going to use that indirect vision on the outside of the mouth. And now I can see that buccal surface, just like this. Here I'm maybe at an 11 o'clock position, And if I really want to use direct vision, I still can do that, but it does require tipping Rebecca back even just a little bit further. Some patients can tolerate this, some cannot. I tug that cheek back. I have Rebecca turn to her right, and there it is. There's the buccal of 15.